Hey family, so today we're going to talk about something extremely important for everybody with a cervix. So if you have a cervix, or if you know somebody that has a cervix, this video is for you. I'm Dr. Katina Richardson. I'm a board-certified family medicine doctor practicing out of South Florida. And today we're diving into cervical cancer screenings, when you should start having them and why. And make sure you stay to the end because we're also going to talk about STI screenings, why you should have them, and the danger or the damage they can cause if they go undetected. The reason screenings are so powerful is that they have the potential to catch problems very early before there's any symptoms. Imagine you just bought your dream car. You're gonna make sure you take that dream car for its regular oil changes. You're gonna go for the routine maintenance to prevent any major issues so that the car will operate at the top of its potential and you can enjoy it for much longer. You're not gonna wait to take your car in when you first start hearing noises. If the first time that you take this dream car in to get checked out is when it's shaking or when it's making noises, we're probably gonna be in a worse situation. And your health is the same. Your first time at the doctor should not be when something is wrong. The key to staying healthy is prevention. And this is why screenings are so important. And this is where your primary care doctors come into play. Having one that you know and trust is so important for your health. They're gonna get to know your health inside and out and guide you through every screening that you need at different points in your life. And just to demonstrate the power of screenings, thanks to regular cervical cancer screenings, death from cervical cancer has dropped dramatically. In the 1950s, cervical cancer was one of the leading causes of death for women in the US. But with the introduction of the PAP smear, we've seen more than a 70% decrease in deaths. That's powerful. So before we get into the detail, if you haven't already, make sure you hit that subscribe button. Join our little community here where we keep these important conversations to keep our communities healthy. Let's keep learning and growing together. Okay. So let's break it down. Cervical cancer screenings, also known as PAP smears, are essential for spotting any abnormal cells in the cervix that could potentially turn into cancer. So if you have a cervix, you should begin your PAP smears starting at age 21. As long as everything looks normal, you're gonna continue this every 3 years. When you get to age 30, so those age 30 to 65, you can either stick with the PAP smear every 3 years, or you have the option to do the PAP smear plus the HPV screening. And with those two tests combined, if everything's normal, you only need to have the test every 5 years. So the reason HPV is so important, HPV, which stands for human papillomavirus, is the most common cause of cervical cancer. HPV is a very sneaky virus in the sense that it can be transmitted just through close, intimate, skin-to-skin contact. Most of the time, our bodies can clear it on its own, but sometimes it can cause changes to the cervix, which can lead to cancer. And this is why regular screenings are so important. So let's not forget about our STI screenings, or our sexually transmitted infection screenings. Sexually transmitted infections can also be silent troublemakers. Sometimes they show no symptoms at all, but they're still doing tremendous damage to your body. Untreated sexually transmitted infections, or STIs, can lead to severe consequences like infertility, chronic pelvic pain, and even an increased risk of contracting other STIs, including HIV. Regular screenings are going to help us catch these infections early, allowing for quick treatment and reducing the risk of complications. Your primary care doctor can guide you on how often you should be getting STI screenings based on your specific lifestyle. So the goal is to detect these problems before you have symptoms. However, if you noticed any vaginal symptoms like unusual discharge, unusual odor, pain, fever, rash, or vaginal bleeding, do not ignore them. Talk to your doctor immediately. And it goes without being said, safe sex is so important. Wearing a condom is so important. And wearing condoms is not just about preventing pregnancy. I have many patients tell me that I'm on birth control, so we don't need to wear condoms. You have such valuable real estate inside you, and you have to protect it. You have the ability to create life. Repeated STIs or untreated STIs can lead to scarring and severe damage of your reproductive organs. So protecting your body, you're not only protecting yourself, you're protecting your future, you're protecting your ability to have children, and you're worth that. Your future is worth that. Make sure you share this video with everybody you know that has a cervix. And remember to stay informed and always advocate for your health. See you in the next video.